I'm Jo Robinson, and I lead the suicide prevention team here at Orygen. Suicide is the leading cause of death in young Australians. 1 in 4 deaths of people aged 15 to 25 is due to suicide. And sadly, these rates are increasing, particularly amongst young women and girls. Our team is working with young people, schools, governments, and social media platforms to really try and tackle this increasingly stubborn problem, and to equip young people, families, and teachers with the tools that they need to keep themselves and others safe. Suicide is preventable, but to date, efforts to intervene have been piecemeal, poorly targeted, and not backed by science or evidence. We are Australia's only research group solely focused on preventing youth suicide. And our mission is to understand the drivers of self-harm and suicide in young people, and to examine the efficacy and safety of interventions specifically designed with and for those at risk. One of our key points of difference here at Orygen is that we not only research the drivers of youth suicide, we also go out into the community to speak with young people directly. We're taking healthcare out of healthcare settings and into the real world. For example, our team was the first to go into schools across the country and talk directly to students, equipping them with the tools they need to identify risks and seek help. Our schools programme has trained thousands of students in Australia, empowering them to play a leading role in suicide prevention. And the programme is now being replicated internationally, including in Chile, India, and the UK. We're also focused on meeting young people where they are, and this often means on social media. The research is clear that social media platforms are a place where young people go to talk about their mental health and where they look for help and support. And that's why we developed ChatSafe. ChatSafe is a world-first set of guidelines and social media campaign designed to support young people to talk safely online about suicide and self-harm. The guidelines are available as downloadable resources, but our programme also includes reaching young people on the platforms themselves via the campaign. ChatSafe also has resources tailored for educators and parents and carers, and they've been implemented across 22 countries and translated into 27 languages worldwide. But we're not only working with young people and their supporters, we're also working with the social media companies to make online environments safer for young people who need vital support that they may not be able to find in their offline worlds. Some of our newest research is focused on better understanding why self-harm and suicide rates are rising so sharply amongst young women and girls, addressing gaps in research and focusing strongly on the implementation of prevention programs that are co-designed, targeted, and effective. We want to end youth suicide in Australia and around the world, and we know that with the right research, the right interventions, and the right education, that goal is within our reach.